We'll move on to the next topic by Dr. Vidya, who will be speaking on understanding the needs. What more can I do to enhance satisfaction among patients? Dr. Vidya, please.
Very good afternoon. I shall be talking to you on how do I enhance my patient satisfaction. A very simple answer would be it's not okay, thanks. A very simple, straightforward answer would be to understand and address the needs of the patient and the expectation of the patient. So, now, what do we mean by patient expectation? It is just that anticipation or belief about what is to be encountered in the consultation or in the healthcare. In simple terms, it is the mental picture that the patient carries when he walks into the hospital. What is not is, it is not restricted only to the clinical outcomes. This is where we go wrong. And it is about the overall picture and overall experience that he encounters from the moment he walks in to the moment he leaves the hospital. So, am I trying to say that there is a disparity in our perception and the patient's expectation? Yes, it seems to be so. Because we as clinicians, we as healthcare providers, we are always talking about the technical quality. See, next 4 or 5 days, we are going to be spending our time on upgrading our technical knowledge. We are going back and we are going to upgrade our technology skills, and we are going to be assessing our skills, and we are trying to provide the best possible outcomes to our patients, which we are not sharing with our patients. The details and whatever we are doing, we are not going to be sharing with our patients. And even if I share, my patient is not going to understand the intricacies of the details that I'm talking about. But what he is worried or what she is worried about is the process that he gets the outcome. The final outcome is very important for him. The process of getting the final outcome is what matters to him. But that is where we are neglecting or we are ignoring the healthcare thing. So, to give you this concept, we are providing a lot of things like look at the square. This is what we provide to our patient. But the patient walks in, he comes with this circle. This is what he wants. Look at this area of intersection. This is what the patient wanted and we also provided. So only we increase this area of intersection, then we have more satisfied patients, and that is what we need to do. So why should we understand? Because that is when we can improve our outcomes. That is where we can ensure compliance with the patient, and that is where we can enhance their satisfaction, and that is where we can also decrease the liability. And when we do all these things, that is where we can actually experience growth and development as an individual and also as an organization. In the world of business, this is what the customer service is all about. It is about 86% of the customers, they say they would want to pay more for the better patient care or better experience. 70% of the experience is based on how the customer feels like they are being treated. And 89% of consumers do not mind shifting to a competitor after a very bad customer experience. And about 92% trust only the recommendation from family and friends. It's not the other forms of advertising. And look at this. This is very important. A 5% increase in customer retention is going to increase your revenue by about 95%. So customer service is definitely a very great competitive advantage. And there are definitely downsides to unmet expectation. It can range from disappointment to anger. Many patients may not complain, but they may not return to hospital also. That can result in poor compliance and also suboptimal outcomes. And 70% is again resulting to miscommunication, this thing. And we should remember the days of absolute trust are already over. And what actually determines this expectation? Whenever a patient comes in, his expectation is basically based on his understanding of the illness. So we are now in the Google times. Patients do come up with a list of provisional diagnoses. They also want to discuss about all the possible things. So we need to remember that. And even the expectation is based on cultural background, his health beliefs, attitudes, and also the level of understanding. And the price that we are paying that for having a dissatisfied patient is really high. So we need to spend quality time in understanding this issue and addressing this. General expectations are that they also want to be listened to. My previous speaker talked wonderfully about this communication skill. And they also want to have a clear explanation and instruction about what their condition is. They also want to be treated by patients, by staff members who are professional in their work, who can also show care, concern, and compassion to their needs. There are definitely unrealistic expectations from the patient side, like they want to discuss several problems all in one go. Some of these patients may also want just a prescription without even a consultation. And these days of increased connectivity, they also want to stay with you connected all the time, 24/7. They want your attention. And sometimes when they walk in, they think that you know all the answers to their problems, and they just want you to give one magical cure that can fix up all the problems, which may not be possible sometimes. A shrewd physician would definitely know how to avoid manipulation with these unnecessary demands. That says without going that we need to have enhanced communication skills, and we need to be like patient enough to explain our complex decision making process in simple terms to the patient, avoiding the medical jargons. That is what we need to do. Sadly, some of these technological innovations have taken our attention from patient experience to more of technology oriented thing. That is something that is missing in the patient care link these days. And as a healthcare manager and policy makers, I really want to emphasize this point that we need to provide great patient experience for them to have satisfaction. So what should be our action plan? One is we need to shift our focus from supply chain to value chain. So what is the supply chain that means? So we are always spending our time in improving our technology, our operational facility. We want to provide the best possible drugs or best possible optical things that is available. And we also want to have a trained professional with us. These are all supply chains. But what we need to do is that we need to create value in each and every point of contact with our patient. That is, it should communicate like pre-service, point of service, and also in the post-service. That is where we can actually make a difference. So the approaches are two. One is a value-based system. The other one is a patient-centered care. Dr. Arvind talked about patient care centered care, which is gaining more importance these days. That is, we are consciously adopting the patient's perceptions into our process. We mainstream into all our process and in the related systems. So it is more of a customized patient care. But what is the requirement is that we need to be more open, flexible, and also respectful when we make these decisions. So that when we do this, our patients do not lose their identity. They do not become one of the cases. They think that they are receiving the best possible care that they could. How can we do this? One is a coordinated and integrated care. One of the previous speaker in the morning also mentioned about the integrated care. Thing is that why do patients worry about their waiting time in the hospital when they do not bother about waiting in a mall or in several other places? Because when they walk into the hospital, they feel vulnerable. They want to have that connect with the physician, not just with the physician. It is from the front line to the support staff. They need to make that connection. So we need to improvise our process flow with this objective, and hence we can improve the patient safety elements as well. And these days we are creating more of silos, like we are evolving into multi-speciality hospitals. Actually, our care should be organized our medical conditions and also the care cycles. It's not about the speciality that matters, it is about the care cycles that matters. Because the current care silos are actually fracturing the medical conditions, and the more such fragments that patient undergoes, there are chances of errors occurring in each segments and safety elements are getting compromised. So this we need to take care. And information, communication, and education is very important, and we need to pay attention to this. The other one is a value-based system wherein we have to create value at each and every point of time, and the value is for the patient. See, as an organization, success is about creating revenue, and it is about operating surplus. For the physician, it may be increase in number of patients and his revenue and his practice. But for the patient, it is not. It is his own good health outcomes, not more hospital visits, not increased cost. So creating value for the patient is the only ethical goal that we all have at this point of time. And I think it is always there. To do this, what we need to do is that we need to measure our results, the outcomes and cost for each care cycle. That is what we need to do. And when it comes to numbers, physicians might take up the responsibility and role and leadership to show the way. Because when we talk about numbers, some of our staff members may view this as a threat. And this perception can definitely affect the performance. So when we say that this numbers can make a real difference and this can push us to achieve excellence, and this is where we can actually make a difference, this kind of exercise has to happen, like results has to be measured in terms of outcomes and also the cost factor. And the other thing is that we need to keep our staff motivated, because that is where we can actually gravitate towards excellence. And to sum up, service delivery is the greatest competitive advantage that we have. And to have this as an effective competitive advantage, we need to have a clear vision, mission, and this has to be converted into a very comprehensible implementation program. And the organization should always have the ability to have the learning and relearning from the past experience. Business people are always crazy about the 10 C's, 7S, everything. So Hong Kong emergency physicians have come up with the 10 C's. See, these are the values that we are all striving for, to sum it up all. Thank you very much. And remember, service delivery is the only thing that can make a real difference. Thank you.
Thank you very much, Dr. Vidya. I have this question which I would want all on the expert panel to comment on. We see an ever-changing scenario now, from acceptance to questioning amongst our patients. So do you think that pricing is a critical factor for the dissatisfaction? How would you address that? And the second thing is, how important do you think it is that we should have a sophisticated ambience compared to more practical surrounds for the modern patient?
I think more than just the surroundings, it is the attitude of the staff and the doctors there. You may go to a 5-star hotel with a very nice ambience, but if the attitude of the staff is bad, if they're not welcoming you with a smile, then you don't like it. I mean, you would never go to that hotel again. Whereas you can go to a small tiffin house where they will say, "Vanakkam, come," and then you are very happy. Food is good, the ambience is not great, but still, you are happy. So I think we should focus more on the humane approach and having a very nice, welcoming attitude of staff. And also, we want to address all the problems, try to resolve problems of patients, and that will help, rather than having a very posh kind of an ambience. Of course, that does help. Posh ambience, you can charge more.
Yours is one of the poshest.
No, you can charge more, but then more than having a... See, it's like you can find the difference. You go to a Taj, the attitude of the staff is different from the other 5-star hotel. So finally, it's the attitude of the staff which will probably bring in patients rather than just the ambience. The ambience is there. If you have a better ambience, you can charge more because of the ambience. But the staff attitude also is important.
I think what Chitra meant was all this is given.
Yeah.
Good staff, good behavior, everything is given. But besides that, in today's world, I think ambience also plays a big role.
Yes.
I mean, ambience, surroundings, everything, every aspect of practice has to be looked at. Yeah. And what you said is absolutely right. You can go to all the 5 stars, but Taj is Taj, wherever it is.
Yes, Dr. Ajay?
Yeah, I think yes, ambience, good, bad, or whatever, but that's attitude. That's what is what makes it. Are you ready to listen? That's the thing. The most of the patients, dissatisfied with the doctor or the staff, or they didn't listen to me. So this is something, as long as we keep quiet, listen to them, and then start communicating, that's where, the ambience and everything will come.
Okay. Thank you very much,